Hi everyone, my name is Tina Otti. I'm a childbirth educator, registered nurse and midwife, and I've been dealing with expectant couples for almost 40 years. Today I'd like to talk to you a little about sleep in pregnancy, sleep or the lack of sleep. Each trimester brings its own complications, if you like, or sleep disturbances to your life during those first 9 months. In the first trimester, most of your sleep issues will come around bladder issues and tender breasts. As your uterus starts to grow and move its way out of the pelvis, it's going to push on your bladder. And then it's, of course, going to make you run to the loo a little bit more often. And we usually do make more urine at night, remembering that you're getting rid of waste for two, as tiny as that little speck may be. You are far more likely to experience fuller bladders a lot sooner. Also, as you move and turn during the night, one of the first signs of pregnancy is a tender breast, and that might be an issue for you in those early days as well. Second trimester, although it's a cooling off period and it's the best trimester of all three, where you get your second wind again, then of course heartburn starts to raise its little head. Cramps in your legs as well can be an issue, and we'll talk about what to do about that. Third trimester, due to the hormones of pregnancy, progesterone specifically, you tend to suffer more from nasal stuffiness. So in fact, you might indeed have, you need to use some nasal sprays, but be careful of the saline sprays are the best. But you might find your breathing might be a little bit awkward or a little bit difficult. Sore legs, sore feet, sore back, okay, can also keep you awake. And of course, your bladder is now feeling the pressure again as your baby's bigger and your baby starts to move down into the pelvis. So what you can do is just take, sleep with a pillow. In terms of positioning, okay, lying on your side is better than lying on your back, and lying on your left side is better than on your right, okay, because when you lie on your back, you lie on your major blood vessels that supply your uterus, and you would normally feel a little bit breathless and automatically turn in your sleep. If you're one of those people that just find yourself on your back in the middle of the night, what you can do is just take a thin cushion and slip it under your right side so that you tip slightly onto your left, and you take the pressure off those major blood vessels. You also tend to snore more. So when you snore more, you open your mouth, and you might then also feel very uncomfortable from breathing with an open mouth. And then have a dry mouth. So be sure to keep water next to you, but sip gently during the evening, and not down a load of or a glass of fluid just before you go to bed. So sleeping on your left side with a pillow between your knees so that your hips and your knees are at a constant or an equal height will take a lot of stress off your back. When you are thinking about your sleep times, try to go to bed at a regular time every night. So if your bedtime is 9 o'clock, which for some women is quite late, for some women it's quite early, try and stick to that time. Stop watching TV about an hour to half an hour before you go to bed. And if you wake up in the middle of the night and you're a little bit hungry or you're nauseous, what you might want to do is keep what I call a sneaky snack, which is a sneaky healthy snack, some biscuits or a ginger biscuit or something next to your bed or in the drawer next to your bed that you can just, take a bite of and just chew on a little bit to quell your nausea. And also if you have any hunger, so that you don't have to get up and trek down the passage or down the stairs to the kitchen where you awake fully. If you're waking up, you're a bit nauseous before you're fully awake, just take what you need, and then you would, you won't be fully awake, you'll be feeling a lot better. What you can also do is, if you wake up and you've got many thoughts going through your head about what you have to do, what you don't have to do, when is your doctor's appointment, keep a pen and paper next to your bed and write down any issues that you may have, so that they're there in the morning and you can just let go of them and not keep thinking, oh, I have to remind myself to do this, and oh, I have to remind myself to do that. Write it down. If it's written down, it's not going to go anywhere. Lastly, don't forget your aromatherapy. A little bit of lavender or chamomile on a piece of cotton wool or a piece of gauze just next to you or near your bed, or a little bit on your pulse points, can do a a lot to calm you and settle you. Please be careful of taking any sleeping tablets, and always check with your doctor before taking any kind of calmets or sleep medication at all. I hope I've given you some ideas as to what you can do to sleep safely and easily. And as you move through your pregnancy, get used to the fact that nature is basically training you for what's coming in the sleepless nights ahead of you.